Good morning. I'm Rebecca Wood, and I live in Acton. I'm speaking in support of an act establishing Medicare for All in Massachusetts. Most of you have heard my story. In it, my daughter was delivered at 26 weeks gestation due to preeclampsia. Over time, co-pays, deductibles, exclusions, and automatic denials involved with her care drained my savings, crushed my dreams of home ownership, robbed me of graduate school, and forced me to make impossible choices. For example, I had to decide, do I pay for my daughter's medical care or mine? On one occasion, I chose to pay for her health care and I put mine off. Due to the delay in care, I developed an infection that spread throughout my entire mouth and jaw. As a result, I lost all of my teeth and parts of my jaw. It took years to recover and should never have happened. Maybe you didn't pay attention to my story because we lived in Virginia when it happened. Maybe you thought that can't happen in Massachusetts. And that's okay if you did. It's a tough reality to fathom. Today, I want to describe some of the things that have happened since we moved to Massachusetts. For example, I had to raise $10,000 on GoFundMe to have reconstructive work done on my mouth. Prior to the work's completion, I was unable to eat most solid foods and I lived in constant pain. My dental insurance maxed out at $1,000 annually. Therefore, I was responsible for the rest. While living in Massachusetts, I was a single mom who had to choose between food or medicine because my drug plan deductibles and co-pays are absurdly high. A few months ago, I had to beg Mass Health to change my daughter's plan during closed enrollment because the narrow networks prevented her from seeing a needed specialist when an orthopedic issue was causing her feet to bleed while she walked. Recently, I was forced to spend over 2 hours on the phone to clear up an MGH billing error. If I didn't, I would have had to pay $683 I didn't owe nor had. I'm crushed by medical expenses. The healthcare system drains my income and robs me of time, opportunity, and ability. My life is dictated by the whims of profiteering insurers, pharmaceutical companies, and healthcare organizations. There is no freedom. I am a prisoner of our failed healthcare system. Medicare for All would allow me to finally crawl out from under the thumb of unscrupulous insurers and narrow networks. My daughter and I would be able to thrive rather than struggle each day for mere survival. Massachusetts has the opportunity to ensure healthcare for all of its residents. Please report favorably on Medicare for All. Let's lead the country in equitable healthcare. Thank you.